This surgeon was convicted of killing 3 patients. 2 years later, those convictions were overturned. He walked free and left Australia the same day. Today, he lives quietly in the United States. So how does a doctor go from director of surgery to 3 manslaughter convictions to a free man? And how many warnings does it take before someone like this is stopped? Hi, I'm Peter. I used to be a doctor. This is the true story of Jaint Patel and the silence that surrounded him. In 2003, Bundaberg Base Hospital needed a director of surgery. It was a regional hospital. Limited ICU capacity, limited specialist backup, limited margin for error. Jaint Patel arrived confident and credentialed, US trained, experienced, authoritative. But his American career had not been straightforward. There had been restrictions on his practice, patient deaths, lawsuits. Those issues weren't disclosed during the recruitment process. He got the job. It wasn't long before staff started to worry. But the surgeries continued, and then patients began to die. James Phillips was 46. He was already gravely ill. Dialysis 3 times a week, severe heart disease, advanced esophageal cancer. He was a fragile patient. Jaint decided to perform an esophagectomy, one of the most complex upper gastrointestinal surgeries. But before the first incision, something critical was missing. The staging imaging, used to determine how far the cancer had spread, was not performed. Despite that, the operation went ahead. During surgery, the jugular vein was damaged. Heavy blood loss followed. Transfusions, instability. After surgery, James deteriorated. His potassium levels rose dangerously high, something his failing kidneys could not regulate. ICU staff struggled to stabilize him. A nurse and a doctor approached Jaint. They urged him to prepare the family for the worst. He reportedly replied, "No way. He's going to get up and walk out of here." 2 days later, James Phillips was dead. Jerry Kemps was 77. He had just celebrated 50 years of marriage. Soon after, he was diagnosed with advanced esophageal cancer. Doctors urged him to travel to Brisbane to attend a larger hospital with greater resources. After consulting Jaint, he chose to stay. He underwent the same operation. During surgery, bleeding began. After surgery, it didn't stop. Blood filled the drains while Jerry was still in recovery. Nurses called Jaint. They were told, "That's what drains are for." The bleeding continued. Transfusions mounted. He was transferred to ICU. Hours passed, no improvement. He was taken back to theatre. When his abdomen was reopened, it was filled with blood and clots. Staff described frantic attempts to find the source. Suction canisters filled and filled again. Jaint could not control the bleeding. Eventually, he said, "There is nothing more to be done." Jerry was closed and returned to ICU still bleeding. Jerry died within 24 hours. 26 units of blood were transfused. By now, this was no longer an isolated complication. It was becoming a pattern. Mervyn Morris was 75. He presented with rectal bleeding. There are established investigations for that problem. They were not completed. Instead, Jaint diagnosed diverticulosis without firm evidence. He proceeded with a sigmoid colectomy, the removal of the end of the colon. After surgery, Mervyn did not improve. He had ongoing bleeding from an unknown source. He required repeated transfusions. His kidneys began to fail. Fluid accumulated in his lungs. He grew too weak to eat. A feeding tube was inserted. He had been frail before surgery. Now, he was overwhelmed. Days turned into weeks. 3 weeks later, Mervyn Morris died. Pathology later found that the removed bowel did not contain the source of the rectal bleeding. The surgery had not solved the problem. It had added to it. By this point, staff were asking a quiet question: how many more? But something else was happening at the same time. Concerns were no longer whispered in corridors. Senior figures inside the hospital had been alerted. Surgical outcomes were being discussed. Patterns were being noticed. Warnings were being raised. And yet, nothing changed. The operations continued. Patients continued to suffer. The director of surgery remained in place. Until one person decided internal discussions were no longer enough. Her name was Toni Hoffman. She was the nurse unit manager of the ICU. She had watched patient after patient arrive unstable. She had watched complications escalate. She had watched families receive devastating news. She documented her concerns. She raised them with hospital management. She escalated them within Queensland Health. Meetings were held, conversations were had, but the operations continued. So she went outside the hospital. She met with her local MP, Rob Messenger. The issue was raised in Queensland Parliament. Now it was public. Media attention followed. The Morris Inquiry was established. Then the Davies Commission. Only then did the full scope of concern emerge. Multiple clinicians had seen the pattern. Few had formally reported it. The culture of silence was unmistakable. Doctors did not easily diminish their peers. Silence was safer. For doctors, but not for patients. Toni Hoffman paid a price. Workplace hostility, professional strain, legal battles. But without that escalation, the operations may have continued for much longer. In March 2010, Jaint Patel stood trial in the Queensland Supreme Court. 58 days. One of the longest trials in the state's history. 3 counts of manslaughter. 1 count of grievous bodily harm. On June 29, 2010, the jury found him guilty on all charges. 2 days later, he was sentenced to 7 years in prison. For the families, it appeared to be justice. But the case was not finished. Jaint appealed. The convictions were upheld. Then the High Court intervened. In 2012, all 3 manslaughter convictions were overturned because the jury had not been properly instructed on the legal threshold for criminal negligence. Retrials were ordered. Jaint was released after serving more than 2 years. In 2013, he was retried for the manslaughter of Mervyn Morris. He was found not guilty. The remaining manslaughter charges were dropped. Instead, he pled guilty to 4 fraud charges related to failing to disclose prior US restrictions. He received a suspended sentence, and he left Australia the same day. 3 men died after serious surgical complications. A jury said it was manslaughter. The High Court said the legal standard had not been properly explained. The convictions disappeared. The deaths remained. And that leaves an uncomfortable space between law and responsibility. Because this case was never just about one surgeon. It was about oversight, about hierarchy, about how warnings move, or fail to move, through a system. Multiple clinicians saw the risk. Some raised concerns. Few acted decisively. And while those concerns circulated quietly, operations continued. Jaint Patel left Australia a free man. The families believed they did not get justice. And the question that remains is not just what happened in Bundaberg, but how many similar warning signs in other hospitals are still waiting to be taken seriously. Because silence does not make risk disappear.